My name is Geraldine Boylan, so I'm the director of the Infant Research Centre, but I'm also a neurophysiologist, which means that I look at how the brain functions when it's working well and when there are problems. So how Infant was set up, I mean, that is an interesting journey. It didn't just happen overnight. We started about 10 years ago. It was based on a foundation of lots of research that had been ongoing for many years before that. We have almost 100 people now working in Infant, and without every single one of them, Infant doesn't work.
The whole idea of the Infant Research Centre is predicated on the fact that you bring together the people who can combine, in combination, deliver the expertise that is actually required to.
I'm clinical lead for neonatal research at Infant, and the principal area we cover is clinical trials in neonatal care. And these trials involve local studies, national studies, and international studies, addressing key areas of newborn care, including trials addressing drug therapies, medical devices, and other studies addressing standards of care. And so over the last couple of years, we've focused on transition, and that's neonatal adaptation. And the key thing about these studies is that they have resulted in changes in clinical practice and ultimately driving standards internationally.
My main areas of research interest include pregnancy loss and perinatal death, as well as complications of multiple pregnancy, prenatal screening and diagnosis, and fetal anomalies. So I lead a big multidisciplinary research group called the Pregnancy Loss Research Group. The Pregnancy Loss Research Group leads national research and collaborates internationally to better understand pregnancy loss experience and impacts.
My research is focused really on finding better ways of detecting and predicting early brain injury. So much has happened in the last 10 years, and it's been really exciting. When Infant started, we were a group of researchers who were all researching in similar areas, and it allowed us to come together and work together and build a team of research staff as well, core staff, that could support the research and allow it to grow.
My own focus is in the area of micronutrients, so that's the role of vitamins and minerals in healthy pregnancy and in healthy growth and development in kids. Our focus has really been on the role of vitamins and minerals in brain development, which is in line with the infant priorities. I'm really proud of the fact that we've continued to survive and evolve through a number of different challenges, and that we've continued to stay together as a team, very, very focused on our mission to improve maternal and child health.
So at the moment we have over 50 studies ongoing at this moment in time, and each of those requires a huge amount of work in the background to get those studies off the ground, to do them in a regulatory compliant way and an ethical way.
The Ultra project, it's Kilimanjaro Ultra 2020. It's a project that aims to develop an electronic data recording system for maternal and child health in low-income settings.
So it's an app on an Android tablet. So when a mum comes in saying she thinks she might be pregnant, all the information that they would normally record in the existing paper system is recorded on the tablet instead. We need the data from these pregnancies to see if we can work out what interventions we can apply to start to bring those mortalities down.
We are leading trials now that we never ever could have imagined that we would be involved in. For me, that's the most exciting thing we're seeing now. We've had 3 spin-outs in the last couple of years.
The NeuroBuild project started as a project to look at algorithms for EEG processing, and within the first year or two of my PhD, we started to look at the idea of an entire system for neonatal monitoring. Infant has been pivotal in my career to date. I came in as a PhD student, focusing on engineering, and have come out the other end essentially as a CEO of a medical device company.
A proud moment for myself and for Infant is that the seizure detection algorithm we've been developing for a good 15 years and now is actually a clinical tool that can be used in the neonatal unit.
As a neonatal nurse, it was very difficult to come into research initially, but with the help and support of Infant, it was great to cross that boundary, and them to help me realise that there's a lot more than I knew, and I had a lot to contribute to research, but yet bring a nurse's voice through research.
So there have been a number of challenges over the years. Funding's always a challenge. I mean, we never have enough funding to do what we need to do.
Funding is always a key issue in a research centre, and we continue to be very competitive in both exchequer and non-exchequer funding, and we'll continue to do that over the years. But also, I think philanthropic support is essential in this area as well.
Despite the challenges that you might face on a day-to-day basis, when you know that you have made a difference to one child's life, that to me that's enough. The centre is successful when you have made that difference.
It was pretty apparent during the delivery that she was in trouble, and when she was born, she was blue, they called her, she was flat. So they were resuscitating her for about 20 minutes. So at that stage we knew she was in trouble. There was just so many people in and out. When they realised that the delivery wasn't going to plan, the NICU team had been up, so they were there waiting for her. When I first saw her, she had been already put on the mat. They moved that quickly. She was put on the cooling mat, and I suppose there were dubious information. We weren't bombarded with it because we weren't able to take it. So the question was never asked, will be part of the answer. She needed it.
Only for this algorithm, they were able to intervene very fast and treat accordingly.
This is so important because for families and for children, so they're at the centre of our research. So everything we do, we involve our children and we involve their families in our research from the get-go. So for example, before we ever do a new study now, we will have parent advisory groups. Sometimes our children are too young to be involved in children's advisory groups, but we would have a parent advisory group getting advice from parents as to what's important for them, what we should measure, how we should measure, what are their concerns. And I think that has made a huge difference because, if you start off doing these studies and you want to make a difference, well, who are you trying to make the difference for? You're making the difference that will impact on children and their families, and therefore they have to be involved in this research from the outset.
I would describe infant in one word as collaborative.
Excellence.
Synergy.
The word would be daring.
Team.
Impact.
With a hyphen, can do.
And I would describe it as collaborative.
Unique.
To describe infant in one word, I think focused is the word that we need to use. We know exactly who we are and what we're doing.